Good evening, everybody, and welcome to the Is the Vaccine for Me COVID-19 vaccine event for young people. I'm Michaela Palmer, the BAME Pan London Coordinator for Westminster City Council, and I'm here to kick things off. Genevieve is going to be presenting alongside me. She's here as well.
Hi, thanks, Michaela. Hi, everyone. Good evening, welcome. It's really exciting to be here. I'm Genevieve. I work alongside Michaela in Westminster's BAME network, and I work with communities in North West, and I'm just really happy to be supporting tonight's event. So thank you.
Thanks for that. Thank you for coming along today. Hopefully this is a very informative, open discussion where all of you get to ask your questions around the COVID-19 vaccine. Over the past 16 months, we've all been affected in one way or another by this virus, and it's really changed our lives. Although restrictions have eased up, we're still having to be cautious around the steps that we take, given that the virus is still with us. And so therefore, we're going to have to take steps over the next couple of years to safeguard ourselves and those around us. The vaccine is now available to people who are 18 and over. And according to statistics, 67% of young people between the ages of 18 and 29 have already taken their first dose. However, there is evidence suggesting that there is some uncertainty around the vaccine. And to be honest, there is reason for that. We're not quite sure if it's effective with all the variants that we're hearing about. We don't know if as young people we need it. And there's lots of information going around. So you're not able to tell what is true and what might not be. This event is an opportunity for you to have that peer-to-peer communication and to also hear from some of the most renowned health professionals that we have to offer today. So as well as having a diverse set of young people with us from all backgrounds and from a variety of ages, we also have an esteemed panel along with us, including Professor Kevin Fenton, the Regional Director of Public Health England, Dr. Mrna Vaccine, Northwest London CCG member for Westminster and GP Principal King's College London NHS Health Centre, and Anna Raleigh, the Director of Public Health Westminster in Kensington and Chelsea. First, you're going to have Dr. Fenton and Dr. Mrna walk you through some of the interesting facts about the vaccine, and then we're going to open the session for you guys to have that honest dialogue, and so you can pose your questions to them. That will be led by Genevieve. In the meantime, I know that you're all keenly aware of how Zoom works, so please ensure that you've muted your speakers when others are speaking, and when it's time to really get into some of that conversation, you'll be asked to speak by our administrators. Before we begin, it would be great to gain your insights into the vaccine and your ideas around it. And so in the chat, there should be a link to a Slido. Please click on it and use there should be a PowerPoint slide with a code to answer a question for us. Please bear in mind, this is anonymous. We're just trying to gauge how everybody is in terms of the vaccine and this conversation. I'll give you a minute to get that started. Once you've gotten the Slido up and ready, please leave a reaction or two using Zoom so that I can kind of gauge. Oh, wow, there are so many interesting points here to touch on. Okay, I'll give you a couple of seconds more. Okay. Please keep going and keep adding to that Slido because that will kind of be the cornucopia of where we're going to steer the conversation that happens today. So thank you for your honesty. I'm now going to hand over to the amazing Professor Kevin Fenton, who'll tell us a bit about the vaccine.
Thank you, Michaela, and good evening, everyone. I hope you're all well and staying safe and managing to enjoy what we have of the summer currently, even with the rain falling outside. I'm really, really pleased to be here with you this evening and to have this conversation about vaccines. So I am Kevin. I'm the Public Health Director for London, and I've been in this job now since the beginning of the pandemic last year. So I've had the privilege of leading the public health response to COVID across the entire city over the past 20 months. And it has been a really, really challenging time for our city. London has been hit hard by the pandemic, in part because we're so connected to the world and we're such a large city, 9 million people living in close quarters. And so the infection has had a really heavy toll on Londoners. But I'm really pleased that after nearly 2 years working on this, we now have an effective vaccine and we're doing really well with getting the vaccines out in the city. So I'm going to take you through a few slides today just to set the context for the conversation today, give you a little bit of information about why the vaccines are important, but why choice and getting informed is also important. So if you have questions, it's good that you have questions because we all should feel confident and engaged and aware and knowledgeable about the vaccine and any treatment before we get it. So today we're going to be working through some of your issues and we'll say a little bit about the vaccines. So on this first slide, this is just to give you a sense of where we are in the city at the moment with the vaccine. It's hard to believe that nearly 10 million doses of the vaccine have been issued in London alone. And that includes first and second doses since we began the program in December of last year. And I'm really pleased to say that slowly but surely, the numbers of vaccines which we're giving to young people under 25 years of age, between 18 and 24, is also increasing. Now, our rates of coverage are lower than other regions in the UK, but we are continuing to increase. And young people are seeing the value of the vaccine. They want to get protected, and they want to be protected in order to get back to normal life. So more than 630,000 vaccines and doses have been given to young people in the city, and we currently have coverage of about 64% of our young people aged 18 to 24 have received their vaccine. Now we see a lot of variation across the city, and on the right-hand side of this slide, you will see the map of the city, and you can see as you move to the outer boroughs of London, we tend to have higher levels of vaccine uptake than when you're moving into the Zone 1 boroughs, the sort of Islington and Hackney and Haringey, even in Lewisham, we see, and Greenwich, lower levels of uptake in younger people compared to some of our outer London boroughs. And among young people, we see lower rates of uptake, especially in young people who live in more deprived parts of the city and or Black and Asian and minority ethnic young people as well. So we do see variations across different ethnic groups as well as where you're living in the city. So the next slide really highlights a few things then about the vaccine and why vaccination is important. So the key thing to remember is that we're a city of 9 million people, and our young people really account for the vast majority of Londoners. So most Londoners, interestingly, are under the age of 40. So we have a higher proportion of our population that are actually under 40. And so a lot of Londoners were just now getting the vaccines, and that's why we're really racing to ensure everybody's covered as well as possible. Now, not only do we have a younger population, but we also have a higher proportion of Black and minority ethnic young people in the city than anywhere else in the UK. And that gives us a rich diversity. And it's why I love London and I've lived in London for many, many years. As you know, there are parts of London that are really deprived, and 8 of our boroughs in the city are among the most deprived boroughs in the country. And that is another reason why we're really working with communities to get the vaccine rates up. And of course, not only do we have a young population, a diverse population, but many of our workers in London are working in the gig economy. They may have unstable incomes. We know that youth unemployment is a big challenge coming out of the pandemic. So as we're having conversations about the vaccines today, there are bigger issues for young people, including mental health issues, employment issues, social issues, just getting back to life, and taking care of their own life journey and their experiences. So I want to acknowledge that this pandemic has been really hard for all of us, but I know especially young people. And that's why I think vaccines are a way to help us to get back to some normality. Next slide, please. So why is the vaccine important for everybody, but especially so for young people? I think there are 4 reasons when I step back and I think about why I am encouraging my nephews and nieces, young people that I'm in contact with, to get the vaccine. The first is that it is really effective in preventing and protecting you from getting COVID-19, getting severe disease, and dying from the infection. And that protection is not just for you, but for those close to you as well, because the vaccine is really good at reducing transmission of infection from you to another person. So it reduces that risk of transmission. And many of you may probably be still living at home with parents. You may be visiting parents and your grandparents, older adults, who may be at increased risk of COVID and dying from COVID. So by getting the vaccine, you protect yourself and you reduce the risk of transmitting it to others. It's also good to get the vaccine because long COVID, so those are the clinical effects of prolonged health effects after you've acquired COVID, happens in nearly 13 to 18% of everybody who gets infected. And we know that as hundreds of thousands of Londoners are getting COVID and have got COVID, tens of thousands of Londoners are going to be, and if not hundreds of thousands of Londoners are going to be suffering from long COVID. And so the vaccine, by preventing infection, also protects you from long COVID. And then finally, we've been discussing this today about, in the summer, we're now past step 4, everything's reopening. We want to travel, we want to go clubbing, we want to spend time going out and eating and enjoying life with friends. The way to do that really safely is getting the vaccine, which is the most powerful tool to protect yourself from infection, and of course, test regularly as well. So the vaccine helps us to get back to some normality. Next slide, please. We've been speaking a lot to young people about some of the reasons why they may not be keen on getting the vaccine. And I was really glad, Michaela, that you did that interactive session at the beginning, because so many of the issues which were on that slide were actually what we're hearing from young people as we're doing research. There are 3 big reasons why I think we see hesitancy or lack of confidence in the vaccine in young people. The first is around misconceptions about their own health, about the vaccine, about its safety, and uncertainty that young people have. The second is if young people don't feel engaged, or if they feel marginalized or feel forgotten or not really respected, then they will not engage. So marginalization is another reason why young people feel that they don't want to get involved with the vaccine. And then the third is fear of the unknown. So people have real questions about, will it affect my fertility? Will it have any other effects on my health? Does it really protect me from COVID, etc.? So on this slide, there are many reasons, many of which some of which were on that first slide that we worked on together. So in terms of the misconceptions, the misconception that, I'm young, if it happens to me, I'll be okay. Again, remember, we're seeing a lot of young people in hospital and in ICU with COVID at the moment. Some people think it's just like the flu, for example, which is again not correct. It's a much more severe disease and serious disease than the flu. And misconception about only the old and vulnerable needing it, for example. So some of those misconceptions we're hearing from young people. To speak up to the marginalization issue, again, one of the things that has really struck me is young people saying, we haven't really been engaged by the government throughout the course of the pandemic. We've had our school disrupted, we've had university disrupted, our lives have been upended. We want to be treated with respect. We want you to hear what we need as young people, and we want you to feel that you're really meeting our needs. And that is an important part of the discussion and why we're having the conversation today. So, thoughts of society isn't set up for me, distrust of government and media, people really feeling about, the government's position on racism and how that affects our community and whether we should trust government. All of these things are valid concerns, and which is why talking about these issues is so important. So we'll have a chance to come back to some of these issues which affect attitudes towards the vaccine. Next slide, please. So there are barriers to getting the vaccine at the moment. We know that. Some of these include safety, side effects, and effects on fertility in terms of concerns. And we also found that for young people, practical issues about getting to vaccination centers are also important as well. So we know that if you have to travel for more than 30 minutes to get your vaccine, you're less likely to go and get your vaccine. If the booking system isn't simple, and if you're not able to do it on your phone, if you're not able to do it easily on the website, that tends to put off your vaccines. And you need to be able to travel safely to get your vaccine. So all of these things are issues that we're working on to ensure that when you're ready to get your vaccine, we make it easy, we make it fast, and you can get it as quickly as possible. Next slide, please. The vaccines are safe, and I'm sure you're going to hear more about the safety of the vaccines today. I just want to say a couple of things on safety. All drugs which are administered in the UK are regulated by the Independent Medicines and Healthcare Products Regulatory Agency. They look at clinical trials as well as data from drug companies related to the safety and effectiveness of the vaccine. And before any vaccine is given, we have to have that sign off by the regulatory agencies. Now, once the vaccine is being administered, we continue to observe the effect of the vaccines within the community. And that's where we look at side effects, and that's where we understand how best to deliver the vaccines. And then if you remember that when we started the vaccines, we were giving AstraZeneca to everybody. And then after the first 2 to 3 months, they changed policy so that only young people were given Pfizer vaccine doses and all the others were given AstraZeneca. So we're constantly monitoring the data for side effects and then updating our policies as needed on vaccines. Next slide. And as we learn more about the safety of the vaccines, we're also learning more about the side effects. And again, we'll have time to discuss this, but serious side effects are really, really rare. And remember now we have millions of people who've received the vaccines across the United Kingdom. And despite these, the level of side effects have been relatively low. The clotting is certainly one of the issues that we identified early, and we've changed policies, so we're seeing much less of that at the moment. And again, focusing on the positive benefits of vaccination, I think, will be key. So, Michaela, I'm going to pause here because we've had a chance to talk about the vaccine, we've had a chance to reflect on some of the issues that are important to young people, and of course, to talk about safety and effectiveness. And I'm really keen to hear from our young people this evening. So I have a few more slides that I'm happy to circulate to those who would like them, but many of the issues on the remaining slides we'll be discussing today as well. So Michaela, over to you again.
Thank you so much for that, Kevin, and thanks for all that insight. It was really amazing. I think we sometimes forget the breadth of London. I'm now going to hand over to Dr. Mrna so she can present her items.
Thank you very much, Michaela. I'll just introduce myself while we're getting the slides up. Hi, my name's Mrna. I'm actually a GP at King's College London, and I primarily deal with a large population of 18 to 25-year-olds. So I have a bit of experience on that end, and I also am I work for the local commissioners as a clinician. So here I am today, and I'm really pleased to be here today and talk to all of you and actually listen to what your concerns are. And Professor Fenton's given some great insights into some of the issues that I think we all have been hearing. So let's just start with the slide deck. If you could go to the next slide, and the next slide, please. So we know that COVID is here to stay, and it's here to stay for a little while. We know that we've heard of mutations in the press. We've heard that these mutations can become more transmissible. What is very interesting, and this is really fresh data that's just come out today, is that 1 in 5 people who have been admitted to hospital in England with COVID are aged between 18 to 34. And that's a really startling figure, considering we would expect that population to be very fit and healthy. It just indicates to us what Professor Fenton was saying, which is sometimes the virus, even with the fittest of immune systems, it can overwhelm your immune system, and it can make you feel so unwell that you will need a hospital admission. Saying that, in Westminster and in RBKC, in the age group of between 25 to 29-year-olds, we have the highest first dose vaccine number. So that is really amazing. And I think some of the work that our public health colleagues have done in trying to raise the awareness has been fantastic. We do know that there is no single one intervention that is effective at preventing the virus. We know that we need to do more than one thing. And that's where I want to bring in this Swiss cheese model. So I'm just going to get to the next slide. There we go. I don't know if you can see it clearly, but the idea here is, as you can see with Swiss cheese, it's got lots of holes in it, but you bring it together. And here what we refer to is some of our personal responsibilities. So things like social distancing, hand washing, avoiding touching your face, not coming into work or coming into your educational institute or seeing people if you are unwell, staying at home. And then the shared responsibilities, which would be testing and tracing and making sure that we're following government advice. And when we need to isolate and quarantine, making sure that we do get the financial support so that we are enabled to follow this advice. And obviously, the other thing would be vaccines. And each of these interventions together comes together, creates multiple layers which improve success. So it is all of us together that we need to continue to do this, even though things look like things are improving. I can see, everybody's out and about, and sometimes it's really easy to just drop that mask, feels really hot, or, you just forget that actually you're in a restaurant, you're touching all your hands all over, and it's easy to spread things. Just to keep remembering that actually COVID has changed the way we work, we live, the way we work, and not for a bad thing. And I just want to bring up an example here is actually because of all the precautions we're taking as individuals, the last flu season, we saw a lot less people have flu than we had anticipated. And that's a clear indication that all of this is working. And that means we're losing less days, being sick at home, losing less time from universities, from schools, from friends, and being, useful to our local communities. If you could move on to the next slide, please. So how do vaccines work? We know, and I did see some questions in that, and it would be good to sort of dispel the myth. This is an inactive vaccine, so it's not live. And we have 3 main ones here: Pfizer, Moderna, and AstraZeneca. And in the particular age group, which is the under 40s, we are actually giving Pfizer and Moderna. And this is what we call an mRNA vaccine. Now, what these do is that the virus is there's a protein which resembles the virus, and that's injected into our bodies, and it creates antibodies. And if you come near the virus, the body remembers this antibody response and becomes prepared to fight it. So the vaccines really trick the immune system to think like you've had the virus so that it's prepared to respond. And that's a really important thing, because if you didn't have the vaccine, then your immune system, and especially in people who are vulnerable, people who have long-term conditions, people who may have diabetes, asthma, might be on multiple medications for mental health issues. In those individuals, having COVID can sometimes overwhelm your immune system so much that you aren't able to use your natural defenses to recover. So having the vaccine tricks your immune system in developing these antibodies so that when you do face that, when you do get exposed to COVID, your body fights that, and you actually can save your body's natural immunity to recover and not be so ill. If you could move on to the next slide, please. So is our body's natural immunity good enough? I kind of covered, some of those points. For example, if you were to have flu or if you had to have any other virus, you normally recover within 2 weeks. And like I said, but in the case of COVID, your body could get overwhelmed. So that can sometimes take considerably longer and may result in hospital admission. And I just want to put some facts out there to you as well. We talked about long COVID, and long COVID is really important because I've heard a lot of young people come and say to me like, oh, I've had COVID, it hasn't affected me. And then a few weeks later, they start reporting symptoms. And that's exactly how long COVID can present. It can present a few weeks after the actual infection, and it can be a multitude of problems. And they say that in England, there are 2 million people who are thought to have had long COVID. And out of that, 70% of young, low-risk people with ongoing symptoms of COVID-19 have had signs of multiple damage to their organs after being infected. So that's a really significant thing because that alters your lifestyle completely. And that is, I think for young people, that's one of the hardest things to actually deal with because they think they've had the infection, they recover, they want to just get back on to normal life, and they find they're feeling drained, they're feeling exhausted, they're feeling anxious, they're feeling depressed, they're feeling that there's pain, they're feeling short of breath, and it can be really disconcerting because you don't know how long that could last. So this is why having the vaccine is so important. It really does help reduces the chance of getting long COVID. Apart from that, we also talked about protecting your own immune system, but also protecting those that are near you. And I know that Professor Fenton's already touched upon that. Can we go on to the next slide, please? So there were some questions that I thought we should bring in here, which I've heard my young patients ask me. And one of them is, if I have a suppressed immune system, how can I take this? Again, this is not a live virus. So at the moment, it is still the risks versus the benefit. So the benefit outweighs the risk in people who have a poor immune system. It is still worthwhile having the vaccine to protect you from the long-term consequences and the risk of admission from having COVID-19. So absolutely, we would encourage people, and that needs discussions with your own individual doctors just to establish exactly what is the best timeline as to when you should get vaccinated if you have a suppressed immune system. The other thing that a lot of people do ask me is about, especially young women, is about the risk of fertility, about pregnancy, and about breastfeeding. And I want to just give you guys one point to take home. This vaccine is absolutely safe to take if you were pregnant, or if you were breastfeeding, or if you were trying to have a baby. And there is absolutely no evidence to link it to any reduced fertility. And just to give you an example, the more and more evidence that is coming out, the more and more cases we are seeing. And actually, there was a case where in America, they've done a study over 100,000 pregnant women. No woman who's had 2 jabs of the vaccine has been admitted to hospital with COVID-19. It does not mean to say that they won't get it. It just means to say that this is not resulting in an admission. Whereas women who have not had COVID-19 vaccine are much more vulnerable to becoming severely ill from the virus. 10% of them require admission to ICU, that's intensive care, and 20% of them can give birth prematurely. So again, really stark facts here that the benefit clearly outweighs any risk. And so again, I would urge any of my patients, young patients, to definitely get the vaccine. And the other bits in terms of wider health and well-being, I have touched about the fact that, having COVID-19, especially when it has resulted in long COVID symptoms or admission to hospital, can be really, tough mentally, psychologically, physically, emotionally, as well as on, close family and friends. So again, I would very much urge that if we can avoid those scenarios, we should, and obviously the vaccine does help with that. Can we move on to the next slide, please? The other questions I do get asked a lot about is side effects. As young people, I'm sure you've already had some vaccines growing up, and like with all vaccines, you will get a bit of a sore arm. You might feel a little bit achy, a bit tired, a bit headachy, like mild flu-like symptoms. Most of this stuff will kind of appear in the first 7 days of the vaccine, but it usually resolves within 48 hours. And you can take paracetamol or ibuprofen or whatever is allowed. If you aren't allowed to use ibuprofen, you can use paracetamol to kind of overcome these side effects. But they are very mild, and most people are able to continue doing what they normally do. The rarer side effects, and I know this is what's attracted a lot of press attention, was all the things about clotting, what we call thromboembolic risk. And again, as Professor Fenton's touched upon, the policy was changed, and now we give Pfizer to the under 40s. And even then, AstraZeneca, when AstraZeneca was given, the risk was so low. It was 4 in 1 million. The risk is higher of getting blood clots by smoking, and other sort of lifestyle related issues. So again, it is about risk versus benefit. And clearly here with the Pfizer vaccine, it is safe. It's absolutely worthwhile taking it. We give it to people with multiple long-term conditions, even those on anticoagulants, basically people who are taking blood thinning medication. We still recommend that they still take this medication. I mean, we still recommend that they take the vaccine. The other thing that a lot of you might have come across was the risk of heart inflammation, what we call myocarditis. And that was also in the news because the Pfizer vaccine, especially after the second dose, both Pfizer and Moderna, there were some reported cases of young males complaining of chest pain, a shortness of breath, and palpitations. And the diagnosis was something called myocarditis, which is just an inflammation of the heart muscle. It does sound quite serious, but actually most of these young people have recovered completely well with just rest and anti-inflammatory medication like ibuprofen. So again, that risk is really low. But again, when I come back to sort of the risk versus benefit, the benefit outweighs the risk here. The other thing is anaphylaxis, and that's exposure to sort of any sort of pathogen that causes a serious allergic reaction. Again, this is fairly rare. And when I've done vaccine clinics, we've gone through hundreds and hundreds of thousands of patients, and yet to come across a patient has a full-blown serious allergic reaction. And when they do happen, they occur within 10 minutes of the jab, and they can be addressed with prompt medical attention. If you want to, and I think that was my last slide. Thank you very much, everyone, and I look forward to any questions, and hopefully I can answer them.
Thank you so much, Dr. Mrna. Yes, we look forward to having that Q&A. I'm now going to hand over to Genevieve so she can present the second half of this session.
Thank you, Michaela. Excuse me. Thank you for setting the scene, and thank you, Professor Fenton and Dr. Mrna, for your really informative presentations. So I was just following the chat, lots of interesting comments and questions coming through, some of which are quite relatable, to be honest, and keen to hear your thoughts and answers, Dr. Fenton and getting you mixed up, Professor Fenton and Dr. Mrna. So I'd like to open the session to you all, where we can talk through some of the issues posted. But before we just do that, I wanted to see if any of you wanted to share or felt comfortable sharing any personal experiences about vaccines or COVID or its impact on you or your communities or family. Don't be shy. We're going to go into questions after this, but I thought it could be a nice opportunity to just share some personal stories. No hands coming up. Seeing a lot of seeing someone come on my screen. Mrna, is that you coming in? Yeah,
Hi.
hand. Okay, yeah,
Hi.
please come in.
Yeah, I just wanted to share my experience.
You've gone on mute, Mrna.
Oh, sorry. Can you hear me?
Yeah.
Okay, cool. Yeah, I just wanted to share like my experience with taking the vaccine. So I've taken both of mine already now. And initially I was really, really hesitant because, as Dr. Mona mentioned, there's obviously there was like not necessarily issues, but there was this whole scare with fertility problems and stuff, and that was a big issue for me because I was like, if I take this vaccine and I never have kids, I'll be mad at someone basically. But I basically just spoke to my GP about it, and he kind of just reassured me that there's no direct link between the vaccine and those fertility problems. And also I had a big problem as well with like how quickly they had come up with the vaccine, and that for me was quite a scary concept to me, just because I was like, okay, this new virus came, no one's known about it, and yet there's a vaccine straight away. And for me that was like a really scary concept, and I couldn't really grasp like that. I like the concept of that and like the idea of it. So I did like speak to my GP, and he was really informative and stuff, and he really did give me like a lot of information about it. And then I also spoke to some of the leaders at my local mosque, and they also like allowed me to speak to some professionals that they brought in one day. And I was really appreciative of that. And just basically, it was just about like lack of information on my part that I didn't have before taking the vaccine. And I think that's where most of my fears came from, just not having enough information. So yeah, that was just basically like what it was for me. That was my main fear. And then once I did have that, I then was comfortable enough to take it. So that's just like my little experience of how the vaccine went for me, and like how I eventually did come to taking it.
Thanks so much, Mrna, for sharing that.
Thank you.
Really appreciate it. It's really good to hear people's personal experiences, and there's no shame. This is a completely judgment-free zone, and it can be a scary thing to get something so new like the COVID vaccine. So thank you. Yeah, so I'll take some questions from the chat now, but please feel free to raise your hands if you want to just come in, and I'll monitor the hands as well and bring you in. But there were a few things that came through. So I'll just start with one of the ones that came in earlier in the chat. Could either of you, Professor Fenton or Dr. Mona, or both, comment on vaccine passports? It's like got a lot of media attention at the moment, and just whether other vaccines like Sputnik will ever be valid to enter other countries. That might be a question that I guess might be unknown, but just want to get your thoughts on it.
I'd like to start, Dr. Mona, from a policy perspective, if that's helpful.
Yeah, please.
An interesting question, right? Because we're in a pandemic, right? The last pandemic that we've been living through was probably the HIV pandemic, and then we're 40 years into that, and before that we had the flu pandemic in 1918. So we're now at a point where we're living with this virus. Millions of people around the world are infected, and the vaccines are the most effective tool that is now available. And so there's a desire to ensure that as we reopen and start mixing and traveling again, we do that as safely as we can. And one of the ways of doing that is ensuring that we encourage everybody to get vaccinated. So when we're traveling on planes, going overseas, or even going into social venues, we reduce the risk of the infection being transmitted. And that's what vaccines do. And it prevents people from having severe disease. So you can see a future in which the key priority for government is getting as many people vaccinated, and ensuring that for those people who are vaccinated, they're able to return to some sort of normal life. In other words, be able to travel without having to do lots of tests, or being able to travel without having to isolate at home for 10 days. Being able to take care of people who are very vulnerable, for example, in social care services, or being able to travel to other destinations without having to do lots of testing and isolation. So these are the benefits of vaccination, and the certification or passports may be a way of doing that. At the moment, there's nothing legally that says you have to show your vaccination status to anything. but the government is certainly encouraging people to be vaccinated in order to maximize the benefits. What may happen in the future, it's hard to say from a policy perspective. In some countries like Israel, Canada, some states and provinces in Canada, and certainly in some cities in the US, they're getting stricter in saying, actually, you must be vaccinated to do certain kinds of jobs. We're not there yet entirely in the UK, but we need to see what's happening globally as we deal with this pandemic. It's a great question to get started on.
Okay. Thank you, Professor Fenton, and apologies if there's a slight time lag with me. My signal's not the best. Dr. Mrna, I thought I'd direct this question to you. So there was a question, again, just going back to what you're talking about in terms of fertility and pregnancy, and there are quite a few comments in the chat about pregnancy and safety. And you mentioned about, pregnant women have got the vaccine and none of them have been hospitalized. Could you explain a bit like the transition between pregnant women not being included in the trials and now being able to take the vaccine?
So, clearly, as when we first started the vaccination, there were studies that were taken. So there were pregnant women who were being monitored and getting the vaccine. And the one that I read about is the one that was being done in America. And I'm going to look at Kevin here and say, if he's had any further insight. But I know that there was a trial, there was 100,000 women, pregnant women, who were vaccinated in America. And that was going on whilst we were still saying no vaccinations to pregnant women. So once they had passed a period of time by which we had observed that they hadn't developed any side effects, and that had been reported, it was then the government then turned around and said, yes, you can safely administer the vaccine to pregnant women. And so as of this now, we're more than sort of 8 months in since starting the vaccination program, and we still have not. So women have been pregnant through this process, have actually gone on and safely delivered as well. And so we can feel pretty sure at this point that the vaccine is safe and it has protected them from the consequences of getting COVID-19.
Thank you, Dr. Mrna. And just off the back of that, while we're on the topic of pregnancy and fertility, breastfeeding, just going back to that for a second, there are a couple of comments about breastfeeding and kind of concerns around there being chemicals in the vaccine that might stay in the blood and that being expressed into the milk. Could you speak on that, either one of you or both?
I would just say that the data out there clearly suggests that there's no known risk associated with giving non-live vaccines whilst breastfeeding. And they have obviously looked into that, including the secretion of any chemicals or anything that would be used in developing these vaccines. Remember, these vaccines are, the constituent of these vaccines is not something that is new. These are the same constituents that you would have had in developing other vaccines. So I guess that should be reassuring to people that we do vaccinate women when they're pregnant. We give them the pertussis jab. We give, that is something that we routinely give, and that hasn't been a problem. So I would say again that, that is the response, just to reassure young people that there isn't any new product in here that hasn't already been used in other vaccines that we're giving in the UK.
That's really good to know, Dr. Mrna. Professor Fenton, sorry, did you want to come in and comment there as well?
Just to, I agree with everything Dr. Mrna has said. Mrna mentioned concerns about the pace at which the vaccines were developed, and Dr. Mrna just reinforced it, that the technology to develop the vaccines had been available long before the pandemic. What we were able to do in the pandemic is actually to both understand the virus and then incorporate the virus into the technology for developing the particular vaccines. And to be honest, it feels as if it was fast, but from my perspective in public health, it couldn't come fast enough. The fact that we initially thought we wouldn't get a vaccine for 2 years, even 3 years, was where we started at the beginning of the pandemic. But we were able to get it within a year, a safe vaccine, and that's amazing. And that's because the technology existed before. Funding for research was increased. We had hundreds of thousands of volunteers who participated in trials and were able to get the vaccine. Just to go back to that point about safety and effectiveness and the research that sits behind these vaccines as well. Thanks, Genevieve.
Thank you, Professor Fenton. There are so many more comments on this, and I'm going to try my best to try and pull them all into one. But I'm going to come back to some of the more recent comments that have just been put in the chat, rewind a bit to some of the ones from earlier. This is a more general question about the vaccine being the best way to eradicate the pandemic, and the debate or the question on that. What are your both thoughts on that? And should there be more public debate potentially on people who think actually the vaccine maybe is not the best way to eradicate this pandemic?
So I thought first.
No, go ahead, Kevin. Go ahead. I'll follow you.
I am always concerned, Genevieve, when people say this is the best thing to do and this is the only solution, etc., because nothing in medicine has ever been down to one thing, right? So we're not ending the HIV epidemic because we have effective treatment. We do treatment and change behaviors and you educate and you support communities. It's that package which is necessary to help to eradicate or to reduce an infection. For COVID, it's exactly the same. The vaccine is one of many tools that we have, but it is the most effective tool that we have. So when we think about ending the pandemic, it's about vaccination plus education, vaccination plus testing and contact tracing, vaccination plus some of the controls that we've had to use over the past year, sometimes encouraging people not to mix in social venues, encourage people to social distance, and space and space. So I think we will live with COVID for some time in the same way that we live with flu and we live with other viral infections. But in order to reduce death, we will need to have the vaccine and education and the testing moving forward. So that's my view on it in terms of how we end this pandemic.
Thank you, Professor Fenton. Yeah, it's so true. There's always a tendency, isn't there, to be like, this is the one, this is the best. But you're right, we probably shouldn't look at it like that in this particular context. Dr. Mrna, did you want to add anything now? Could I go on to the next question?
No, yeah, go ahead to the next question.
Yeah. Okay, so there are lots, but an interesting one I thought was about long COVID and if there's any data on the vaccine preventing long COVID.
I mean, I would say as a clinician that we've definitely seen that people who haven't been vaccinated, and I'm going to give you I'll leave the sort of data and all that to public health experts, but I think in terms of as a clinician on the ground, what we definitely see is people who haven't been vaccinated are those that are suffering from symptoms of long COVID, and those that are vaccinated are not suffering. And again, I would say that we do not have, and this goes back to sort of the question that was just raised. Well, can we say with absolute certainty that this doesn't cause long COVID? No, we can't. But what we can say is what we're seeing so far, that there is definitely a reduced incidence in people who have had the vaccination.
Okay, thanks, Dr. Mrna. And could you tell us a bit about what the situation is with mixing vaccines? This is something that I've personally kind of tried to grapple with. Can you mix vaccines?
Sure.
And yeah.
So ideally, you want to give the individual the same vaccine that they've had. But we know that with young people, especially people who are coming from international places where they may have had one dose and a second dose might need to be given here, there is some very strict guidance that's come out about how what kind of equivalents would be available. And actually looking at that list, that list covers pretty much most of the vaccines that I've already encountered, everything from Sputnik to Sinopharm, Sinovac. And so we would give the locally available equivalent. So at the moment, that hasn't been an issue. We haven't seen a vaccine that somebody's got internationally that absolutely doesn't ring bells with us. But if that was the case, there is guidance that if we cannot recognize this and there isn't a locally available alternative, then we would restart the course here. So in terms of mixing and matching, we aren't doing that. We are trying to stick with local equivalents or exactly the same vaccine. And the main reason for that is because if you did, and even if you did by accident mix and match it, it's not a bad thing. It's not like it's going to do a lot of harm. It just means that that person may have some slightly more side effects with the second dose than they would have had if they had had exactly the same identical vaccine that they should have had with the first. I hope that makes sense.
It does. Thank you, Dr. Mrna. Just for the sake of time, I'll go straight on to the next question, which I'm going to read as is because it's pretty self-explanatory. So someone in the chat has said, from my work with young people, there's a suggestion that they have felt blamed to some extent at various points in the pandemic for transmitting the virus more than other age groups. And now there's a sense of being prompted or told to take the vaccine now, which may be confusing and demotivating. So just wondering thoughts on that. And there were other comments generally about feeling a sense of forced, and actually something that people mentioned in the Slido as well. So just your thoughts, please.
So I acknowledge that when I gave my opening comments, that it's been such a hard year and a half, maybe 2 years now for all of us, but especially young people. And, you know, I acknowledge that young people have really borne much of this pandemic, you know, disruption in education, university, not being able to do the things that we all did when we were 18, 19, 20, going out clubbing, having a good time. And lives have been put on hold. Because we've been going down the age cohort, it started with the oldest and most vulnerable, and then we've been going to the over 70s, over 60s, over 50s. For many young people, they were not necessarily engaged with the vaccination program until a couple of months ago when we really began to get to the under 40s. So what may feel like pressure to you is just that we have just reached the cohorts to deliver the vaccine to the under 40s. And so now we have the chance to really engage communities and young people about the vaccine, because the guidance and the policy is now for everybody over 18 to get the vaccine. I think it's important that we listen to you all as young people about what you need to make a decision, how we can support you. And I'm very keen as a public health doctor to ensure that we think about all of your needs, not just getting you the jab, but to talk about your mental health, to talk about what your jobs and what's happening with your housing and the opportunities that you have in the city. And I know that other leaders in London and the mayor are really keen to have that conversation as well. So yes, it may feel as if there's a pressure now and it's all about getting the jabs into young people, but we've been on this journey for many months now. And now is the time to really ensure that everybody over 18 gets it and that we listen to you on what you need to feel safe and confident to get the vaccine.
Thank you so much, Professor Fenton. If you're okay, Dr. Mrna, I'll wrap up that just for the sake of time, unless you had anything pertinent to add. No? Okay. So thank you both. Thank you to our panelists and to you all. Sorry, I feel like we didn't get through all the questions and comments, but hopefully we touched on kind of the key themes that came through the chat there. I hope you've received some answers, reassurance or direction at least to your concerns, and that this discussion was helpful in some way. We're now approaching the end of the session. So if you have any further questions, you can either visit the resources on screen. There have also been some links posted in the chat, or email us at publichealthdepartment@westminster.gov.uk, and we'll get back to you as soon as we can. So for the last time, if you can take it back to Slido, so slido.com, just take a few moments to type in the code, same code on the screen, and let us know what would help you get your vaccine if you haven't already. We're really keen to hear your thoughts on that, especially in light of this conversation. So I'll give you a moment to get that all up. And while you're doing that, sorry, got so many screens going on. Yeah, while you're doing that, and before I hand over to Anna, our Director of Public Health, we have Dr. Leonora Whale from Public Health England here to talk to us about their summer festival for young people, young Londoners, taking place later this month. So while you're doing your Slido, please listen in. Leonora, would you like to take over for a moment?
Thanks so much, Genevieve. Great to hear all the fantastic comments and a great event this evening. So thanks very much for inviting me. So as you said, I'm a public health consultant. I work within Public Health England in London, within Kevin's broader team. And really to call for you a call to action today, and to really understand. So with all the voices that we've had, and there's a real recognition that young people have been disproportionately impacted by what's happened in COVID. Particularly in terms of their mental health, broader physical, sexual health, etc. So we've been partnering with NHS England, with the Mayor of London and his team to work on innovative ways to co-produce and co-design a series of events for young people to address health and well-being needs in the wake of the pandemic, including conversations around the vaccination. So we had 2 roundtables, and they were held and hosted by young people, for young people, really discussing about what they liked about London, what was important to them, and what a health festival would look like. So they said, and many of this will resonate by some of the things we've heard this evening, they want peer-led, honest conversations in spaces from people who look like me, young people, young doctors, honest conversations. They said mixed media would be important, so online, live events, creative festivals, dispelling myths, debunking some of the things that have been going around, and really honing in how important diversity is, and also that young people are not a homogenous group. Each of them have their own needs and needing to work with all young people across London. So we took on all of that, and we've pulled it together with young people and working already with young people in the design and process of the next steps for 4 broad interconnected events, focusing on a summer health festival towards the end of August. So what we're looking for is young people aged 18 to 25 to work with us on these events. If you just roll to the next slide, I'll just whiz through some of the options that are available to you all. So if you'd like to be involved in designing the creative concept for the week, something that speaks to young Londoners about their health and well-being, conversations and vaccine, working with a creative agency, Liberty, to develop an identity that brings the events together, that's one thing you can be involved in. Shaping the NHS, online activity with brands. So again, young people said they wanted to hear from health professionals, but how do we reach young people? So making sure it's partnerships with brands, influences on those key events. The third one is the option to either run an event over the summer or decide who should be given funding. So we are awarding grants of up to £1,000 for different groups to do events such as these all over London, and we'll be judging those over the next week. So if you want to be involved in judging, you need to be there for the 12th of August. And the fourth one is young people said they wanted young peers to speak to them. So we're doing a young community champion program, and you can be a young champion having those conversations with people around the vaccine. So on the next slide, and we'll circulate all of these. I know there isn't much more time this evening. If you want to, there's a very, very simple form that you can sign up to choose any of those 4 options. We really want to work with young people on them. Or if you want to run an event, if you just turn to the next slide, you'll see the second link is how you can apply for £1,000 to run an event during that week, talking about health of young Londoners in the wake of the pandemic. So thanks so much again, and looking forward to hearing from you.
Thank you, Dr. Leonora. So I'm going to now wrap up and hand over to, again, like I said, our Director of Public Health, Anna, and just to say thank you so much for that announcement, and also for this evening's really interesting and engaging discussion. That's it from me. Over to you, Anna.
Thank you, Genevieve. Thank you all for giving up your time this evening and for bringing your genuine questions and concerns and putting them in front of our panel. A big thank you to Professor Fenton and also to Dr. Mrna and Dr. Wheel for coming along this evening and spending some time with us, talking about the importance of getting vaccinated, protecting ourselves, protecting our loved ones, and protecting our communities. I know that the past 18 months have been really difficult for everyone, and now we're learning to live with COVID. This is a real step change. So a key part of this is getting vaccinated so that we are protecting ourselves, our loved ones, and our communities. If you're over the age of 18, you can walk into a vaccination centre at one of our locations or at one of our bus locations, whether it's for your first dose or whether it's for your second dose. After you've had your first dose, your second dose takes place 8 weeks later, and that's because we get a better immune response 8 weeks after that first dose. So please follow one of the links on the screen here to find out where our vaccination centres are in Westminster and in Kensington and Chelsea. If you haven't already heard, Heaven nightclub is being turned into a pop-up vaccination centre on Sunday, the 8th of August, and that's going to be taking place from 12 noon until 9 p.m. First doses of Pfizer vaccination are going to be available for everybody who attends. You can walk in, and walk-in appointments are available on the day, but booking is recommended to guarantee appointments. I would really urge you to join the millions across London who are already vaccinated, and to encourage your friends, your family, and your community members to do the same thing. Finally, a huge thank you from us for listening to us this evening and for sharing your questions with us. Anybody whose question hasn't been answered, email into us at the public health email address in the chat, and we will respond to those questions from one of the public health team locally. Good evening, everyone.